3:30 p.m. as we explore Gombe's transformative journey to greatness.
At TVC News, wherever the big news story is happening, we're geared up to break it. TVC News, first with breaking news.
And welcome to TVC Midday News. We are still tracking developments from the petrol tanker explosion in Jigawa State, which killed more than 150 people. Now, 32 victims receiving treatment at the Aminu Kano Teaching Hospital are said to be responding to treatment, while in Yobe State, health personnel are working round the clock to provide care for victims. TVC News' Michael Ashoma and senior reporter Ibrahim Isa report here.
It's been 48 hours since a tanker carrying premium motor spirits exploded in Majia, Taura local government area, claiming over 150 lives, injuring many others. The injured were rushed to various hospitals, including facilities in Buru, Yobe State, Duse in Jigawa, and Aminu Kano Teaching Hospital, AKTH, in Kano State. 32 of the injured are now receiving care at AKTH, with many housed in the Magaji Nambata Bonds ward.
So presently we have bed capacity of 18 and same occupied by Bonds patient.
Victims speaking to TVC News recount the harrowing experience, sharing their grief over the loss of loved ones in the explosion.
We had people asking for help in town, that a tanker has fallen. At first, we thought it was a thief, and I later learned that my son was out there, so I rushed to get him, then I got caught. Around 11 p.m., we were about to lie down. We heard the tanker fell. Then we heard that our young ones are out. We were caught up while trying to save them.
The management of Aminu Kano Teaching Hospital says they have been providing continuous care for the victims since their arrival.
At present, we have an admission and had 32 patients that are admitted in various wards with burns injury. The mouse ward is already filled up, so we have to move on patient to act.
Treating burns is undoubtedly expensive, but the Aminu Kano Teaching Hospital is providing 48 hours of free medical care to the victims. But as that window closes, they call on the government and philanthropists to wade in and provide support for their full recovery. Typically, burn patients can expect to recover fully within 3 to 6 months, though in some cases, it may take up to a year. Among those affected is Muhammad Shuaibu, a former member of the Jigawa State House of Assembly. He tragically lost a son in the explosion, and another child is currently undergoing treatment. Shuaibu has called on the government and security forces to secure areas prone to such accidents to prevent future tragedies.
Whenever such accidents happen, the government should take a major action.
As time passes, the victims remain hopeful that, with the necessary support, they will recover and return to their lives. Ibrahim Isa, TVC News, Kano.
This is Federal Medical Center in Unguru local government area of Yobe State, where some of the injured victims of the Jigawa tanker explosion are currently receiving medical treatment. This is the emergency unit where the lives of some victims of fuel tanker explosions hangs on a thin thread. The burns on the survivors' bodies serve as a haunting reminder of the unimaginable horror and agony they endured. Yet, Despite their traumatic experience, they consider themselves fortunate to be alive. Now, they pin their hope on the medical treatment they receive here, which promises a second chance at life. Fatima Musa, the mother of one of the survivors, was overcome with emotion as tears streamed down her face. Among the 35 survivors brought to this healthcare facility, 4 are children between the ages of 10 to 13 years. Sadly, 2 children in the same age group were among 6 confirmed dead by FMC medical officials. The healthcare workers spoke with TVC News. They are devastated by the loss of lives, but working hard to save more lives.
So we were informed that there are many on their way. So we understand that seeing the gravity of the burns, we have to devise a strategies, mobilize doctors as well as the nurses and the attendants and volunteers. So we evacuated the normal accident emergency patients to other wards, preparing a venue and place to receive those explosion victims.
We have overstressed our resources. We have to call for external help, and even we are still on it. Like, since they have brought all the patients since yesterday, we have to find a way of creating space out of inavailability of space. We've all been on our tools since yesterday, and even to get time to rest has been very difficult.
We were told that many of them were unable to open their eyes when they were rushed into the facility last night. But now they are responding to treatment. As the survivors continue their gradual recovery, medical staff remain optimistic for a successful rehabilitation and discharge. Michael Oshoma, TVC News, Nguru, Yobe State.
Let's now bring in our reporters, Ibrahim Isa in Kano, Michael Oshoma in Yobe, and Yusuf Isa in Jigawa State for more on this developing story. Gentlemen, the Tuesday tanker explosion in Majia town has left many dead with others receiving treatment. Talk to us about the well-being of those in your respective states. Let's begin with you, Ibrahim.
All right, thank you very much. The 2 victims of the tanker explosion.
Video ba kaina nake yi wa ne muna magana ne.
And I learned that they are currently responding to treatment. No life has been lost since they were in the hospital. And I also learned that with regards to the Jigawa state government is in talks with the AKT officials. The discussions are ongoing as the 48 lapses yesterday night. They are currently in the hospital and they are currently being given antibiotics and other medics to ensure that they stabilize and begin their journey to recovery.
All right, and let's turn our attention now to Michael Oshoma. We saw pictures there of people, victims, survivors of this in the hospital. Talk to us about how they are getting better and how families are actually reacting, especially concerning the children who are involved in this.
Well, the relatives of the survivors are in a sad mood, but at the same time, they are grateful to God that their children are alive at this point. They are also grateful. They express their gratitude to the government for footing the bill, the hospital bill, and all that. They are responding to treatment at the moment. What I noticed when I visited the hospital this morning was that the hospital officials, they need more hands to accommodate the treatment of the survivors. We noticed that few of them are being attended to while others are left unattended to. So they are calling for other people to come and assist them so that they can be able to speedily attend to these survivors at this moment.
All right, and let's see what the situation is in Jigawa where this incident actually took place. Yusuf Issa, bring us up to speed on the well-being now of survivors who are recuperating in Jigawa.
So most of the survivors now are in 3 different hospitals. First one are in Rashid Shakoni Specialist Hospital, and they are receiving free treatment from the state government. And the second categories are in Unguru, where the state government sent them there to receive their own treatment. And also the third categories are receiving their treatment in Hadeja General Hospital. And actually, when I interview the medical doctor that is in charge of center in Unguru, he said the situation is really there because they are not even responding to the treatments. Actually, the victims are not even responding to the treatments because more than 70% of their body burn. So this is a really tragic incident and a really tragic situation in Jigawa. The whole of Jigawa are now mourning because it's losing more than 168 people, which are 70% of them are youths, is really devastating to the people of Jigawa, to the people of Majia, and also Jigawa in general.
Indeed, Yusuf. But what is the situation in Majia? Have, the debris been cleared? Is there free flow of traffic around that area now? And how are residents of that community getting back?
The residents of that community are now receiving condolence from different categories of people. The politicians are trooping into that community to condole with them, and also the philanthropists. Likewise, the families are also receiving that condolence from different people. Then the situation in that area